I'm Rick McGuire, the executive editor of CardioSource WorldNews, and I'm still here at the Cardiovascular Care Summit, Solutions for Thriving in a Time of Change. And one of the co-sponsors of this meeting with the ACC is the American College of Physician Executives, the home for physician leaders. And I'm with Barry Silbaugh, who happens to be the immediate past CEO of that organization. You had a great presentation. You're talking about Venus and Mars. Why can't hospital administrators and physicians get along? And it's a great question. Why can't they?
We come from two very, very different cultures. And we think differently, like different tribes. We act differently. We have a different worldview. My belief is that those cultures are going to merge in the future through healthcare reform as outcomes, cost, quality, and patient safety become much more important. So I don't think we're going to see quite the separation we have now, but I did talk about the separation of the cultures and where it's heading.
But when you have Venus and Mars combining or colliding, it's not a happy picture that comes together. How is it going to work, and how can both of them get along with each other?
I think, first of all, exploding some myths about hospital administrators that have existed for a long time, perhaps in our own minds, one of which is they are not smart enough to get into medical school. That's a myth. There is absolutely no evidence whatsoever for anything like that. Many hospital administrators are very, very smart. Some have started medical school and realized very quickly, this is not for me. And because of the nature of patient care, they'd like to continue to help in the industry. Number two, there's a myth that hospital administrators don't like doctors. The fact is, many of them struggle to figure out how to get along with doctors, because we have some very interesting ways of looking at the world and expressing ourselves. And many of them know that their career in large part depends on their relationships with physicians. Far from disliking doctors, I think they have a profound respect for what physicians do, particularly cardiologists. They hold them in awe because of the organ system that they work on, as well as the importance to health systems. A third myth is that they don't want to help others like we do as physicians. In fact, they consider their work to be part and parcel of providing high-quality patient care to patients. They just use a different set of professional skills to make that happen and to help that happen.
With so much change going on, it's no wonder that this has been an extraordinarily popular meeting, the Cardiovascular Care Summit. What do you think the take-home messages are in this massive time of change with, the ACC did a survey recently and something like 87% of cardiologists are saying they're really stressed. What are some of the solutions? What are some of the things we need to look at in the days ahead as we move into this new world?
That's a great question. The most important thing, I believe, is the role of physician leadership in helping to change the health system. The things that are happening in Washington are definitely political, but healthcare is a huge economic burden on big business, small business, individuals, and something has to change. We believe that the payment system is absolutely going to have to change from fee-for-service to paying for outcomes, and as that transition takes place, it's physicians that will have to step up to the plate of leadership and say, here's how you can make that transition to assure good outcomes while keeping the cost down and affordable. And if physicians simply look at some career options in addition to one-on-one patient care, like being leaders in their health systems, in their community, in their university, et cetera, I'm convinced that we're going to come out at the other end with a much better health system.
It's not like the federal government is going to come in and have massive control over everything. There's still going to be a regional or local leadership that's necessary, and you're saying it should be the cardiologists who are helping lead the way.
Well, yes, and cardiologists more and more are working in the hospital. Many of them have become employees of hospitals, as you know, over the past couple of years. Because of that, you're going to be in much closer proximity with the other side, if you will. Whether that's Venus or Mars, it depends on your definition. But we have to learn to work together, and I think there's a natural affinity as a business thinker to having cardiologists as clinicians, as colleagues in redesigning a system for better outcomes for patients.
Doctors love clinical medicine, or they wouldn't have gotten into it. It's the business side of it that they've I think, tried to avoid over the years, and I think there's no avoiding it anymore.
No, that's correct. We were never taught in medical school about business, about leadership, about quality, about safety, but these are things that we have to learn and learn very quickly now, how to be effective, how to influence, when to use our authority that we're very comfortable with as physicians, because after all, we write orders. We're very comfortable giving people orders, but to get things done in an organization, it requires a whole different mindset where group process is important and figuring out how to work with other people so that they get their values served as well as you getting your values implemented as well.
Thank you, Dr. Silbaugh. I really appreciate your assistance here.